Hello and welcome to Local Doctors on Call. I'm Alex Redmond. Our vision is one of the most important senses and also one that we often take for granted. We go for annual wellness exams from infancy and visit the dentist a couple of times a year. But most of us aren't sure when to get our eyes examined or how often. Should we wait until there's a problem or notice that our vision isn't what it used to be? And how young is too young? And most important, is it possible to have a serious condition without any symptoms? Well, today we're being joined by two doctors who will answer all your questions about eye exams and the latest diagnostic technology available to you. Dr. Kathleen McCabe is a board-certified ophthalmologist, a cataract surgeon, and a high-tech intraocular lens replacement specialist practicing at Cantor Eye Associates. We are also being joined by Dr. Steve Bovio, a board-certified optometric physician, a member of the American Optometric Association and the Florida Optometric Association. Dr. McCabe is a regular guest on Local Doctors on Call. And Dr. Bovio, you are new to us, so tell us a little bit about yourself.
Oh, well, thank you for having me on. I have a primary care eye doctor's office, primary care, and we specialize in eye care for the whole family. Ocular disease treatment and diagnosis of ocular disease, contact lenses, eye emergencies, and we have an on-site optical also.
All right, so you take care of the whole family.
Yes.
Well, let's talk about the family then. When should somebody have their first eye exam? When a child?
Yes, the American Optometric Association has shown that early detection of ocular disease is necessary for full development of their vision. So they have actually come out with a program called Infant C, which I'm proud to say we participate in. With that program, we offer free visual examination for children before the age of 1. After that, it's recommended between the age of 3 and 5 to have their vision rechecked again, make sure their development the way they should. As they get older, if they need glasses correction, we oftentimes recommend contact lenses for children at an early age if they show maturity. That's better for sports, better accommodation, better tracking skills, better safety.
Well, what about learning? Is
learning is huge. It has been shown that 80% of learning is visual at a young age. It's heartbreaking to see that we have children come in who have been struggling in school for a couple years, and all along they have needed visual correction. You can see what a big impact that would have on their confidence and their development.
All right, what about for people that have difficulty reading up close? Are there any options for those?
There's a lot of options, and it's exciting now because there's a lot of things that have progressed. The new progressive eyeglass lenses have gotten a lot better, and they're doing much better with that, and that's showing a lot of life. But it's exciting to see the changes in multifocal contact lenses. We now are able to fit most patients, just about every one of them, multifocal contact lenses, including patients with high amount of astigmatism. So it's exciting to see the freedom these patients are getting from having to put glasses on. Our whole world these days is up close. The cell phone rings, you need to be able to look down and read that right away. And we're having success. Even patients later in life, first-time wearers, 6 years old, the freedom's amazing.
And also, Dr. McCabe, there are many other options for people that aren't eligible for contact lenses. Perhaps they might need a surgery, so what would you do?
Well, surgery for freedom from contact lenses younger than the age of 45 or so, LASIK is a great option. Once you get older than 45, just like needing multifocal or bifocal contact lenses, we have lenses now that we can actually place within the eye, and especially in patients who have had the advantage of using those lenses as a contact lens, we can now use an intraocular lens that does the same sort of thing, gives them a range of vision after cataract surgery even. So the multifocal or bifocal contact lenses are a great segue to later needing an intraocular lens that will have some of the same sort of technology in it. So that's really a nice progression that can happen.
And of course, we want to let our viewers out there know that during the second portion of the show, we'll be opening up our phone lines. And at around 7:15 or so, 7:17, you can go ahead and call us at 361-4675. So you can write that number down, 361-4675, because both doctors will be answering your questions about what's involved in eye exams and the latest technology, etc. And so what about somebody that has discomfort within their eye, or they continue to have a discomfort in their eye?
That's a good question. That goes into the ocular surface disease category. There's a lot of progress with that. And we need to find out what's the cause of the problem. It starts with the lids. You have blepharitis, meibomian gland disease, dry eye syndrome, and it can be a form of conjunctivitis, whether bacterial, viral, or allergy. But a lot of these chronic conditions need to be treated, and I see a great bit of success with that. Some patients, for instance, were told they had dry eyes, and then they're using artificial tears, but they're never really getting the relief because the underlying condition wasn't treated, like blepharitis, which is a lid infection or lid inflammation. Once you treat the blepharitis, it's going to allow the lids to produce more of the tears that are needed to help fight off that dry eye problem.
Yeah, and it's really amazing how many people come in with dry eye.
Yes.
Especially in a primary care practice.
Yes.
I'm sure it's a huge percentage of, especially your elderly patients. So.
And studies have shown
really
that has been overlooked by many eye doctors, and we spent a lot of time making that a big part of our practice. And we see exciting because we see a lot of people that are happy. Eyes look cleaner, whiter, clearer. They look much younger.
Yeah.
What are some of the diseases that you can detect during an eye exam? Because we're actually, later in the show, we're going to go through some of that footage and show what happens when somebody goes in for an eye exam. But what are some of those diseases?
Yeah, well, you know, the medical diseases you're referring to? Yes. Well, diabetes, of course, can show up in the eyes, and then hypertension sometimes show up earlier in the eyes as well. Now, the diabetic patients, that would be one thing we want to get across, is that they need to have their annual eye exam every year. It's sad to see patients come in who have diabetes and they know it and they're not getting their eyes checked. Diabetes can cause bleeding and hemorrhaging in the back of the eye, and that needs to be detected early and treated before it causes any permanent loss of vision.
All right. We're going to go ahead and take a little break, and when we come back, we are going to go ahead and show you some of the video from my office visit with Dr. Bovio, and then we will all be discussing what happened there. So stay with us. We'll be right back. Welcome back to Local Doctors on Call. I'm Alex Redmond, and today we are being joined by Dr. Kathleen McCabe from Cantor Eye Associates and Dr. Steve Bovio from Gulf Coast Eye Center, answering your questions about eye exams and the latest diagnostic technology. And before we went to break, we mentioned that we have a little video, which we are going to show you right now, of my visit to Dr. Bovio's office, and we'll discuss that. We'll see what's going on here.
Okay, right here, she's having the Optomap retinal camera. She's getting a retinal photo of her eyes, and you can see it being taken. And
so there's a photograph being taken of her retina right now. What are these
This
veins?
is a picture of her eye. This is her optic nerve. There's her arteries and veins. You can really get an idea of the vasculature system in the back of the eye. Then we'll go over here to the macula, which is the center of our retina. It gives us our central vision.
And this is somewhere you might see something like diabetic changes or high blood pressure changes, so that's nice.
And this camera is interesting because it goes way off in the peripheral. You see all that. And this is excellent for educating the patients as to what we're actually looking for in the back of their eye. And the black and white version, as you see here, really highlights the blood supply in the back of the eye. It's quite interesting.
All righty.
Here she's going over to the endothelial cell count machine. This is excellent tool. It measures the back layer of the cornea, shows all the cells in the back layer of the cornea. This is interesting, important for contact lens patients to monitor the health of their eye. And here I am showing the cell count in the back of her cornea. We're born with one layer of cells in the back of the cornea, and that's all we have our whole life. And as we get older, they will degenerate and change shape and size. And this helps us track that for any kind of corneal disease.
And those were my eyes.
Those are your eyes. They look excellent, by the way. Yes. And
this,
here's
however.
There's a picture of Gattata, which is a corneal disease that we see sometimes in patients that get older. Here you're getting an autorefraction done. This gives us a baseline measurement of what your prescription for glasses would be. And there's Sunny taking that measurement for us.
And so what is happening while I'm looking through there? You could actually tell the audience what's happening, our viewers.
Yeah, now this particular instrument is a corneal topographer. This is excellent. This is excellent to give us a great view of the cornea. That's her cornea right there. And that's going to enable us to get an excellent fit with the contact lenses. It's interesting, this next view is going to be a three-dimensional view of your cornea. And this also helps for corneal disease
And dry eye even.
Dry
You can
eyes,
see
yeah.
irregularities from dry eye.
All right, so we're going to come out of that video and we'll continue discussing some of these eye exams now between the three of us. So that was very interesting, because one thing that I would like to let our viewers know out there, because people are very hesitant, they don't know what to expect. There are a lot of new developments in technologies, and the one thing that I have to assure people is that I took about 7 or 8 tests.
Yes.
Not one of them was uncomfortable, nor did it hurt. I felt absolutely nothing, other than I was concerned that my hair wouldn't look as good when I got done. No, but
Yeah.
seriously, I mean, it was a piece of cake, and very great tests. So let's talk about some of those tests that we just saw. And what would you do if you did find something wrong with somebody's cornea, et cetera?
Yeah, so dry eye, you know, that's, as we talked about, such a common ailment in patients. And
Yes.
when you have the ability, like Dr. Bovio does, to do some more sophisticated testing, it gives us a better idea of why maybe they have irregularities on the surface. So if you can look and see that the endothelial cells, that inner lining of the cornea, is irregular or unhealthy, that gives us an idea of what treatments would work best. And you can follow the dry eye in treatments and see whether or not that topography has improved over time.
Yes.
So it's really a
Excellent
powerful
point.
tool.
All right, and we're going to remind our viewers out there that now would be your time if you would like to call in, 361-4675. Again, our number is 361-4675 with your questions for Dr. McCabe and Dr. Bovio. So let's talk a little bit more about what goes on with the eye exams and what some of the other things are that would happen.
You know, we showed you all the equipment there, and with all that, we make a great assessment of where your vision is at and what's the best treatment plan to get you to see better.
Is there a time that somebody should get a baseline to come in? If say someone's in their 20s, they've never had their eyes examined before, but they have no problem, should they still come in and get a baseline?
It's definitely worth doing a baseline, and that retinal photo, as you showed there, was an excellent way to have a baseline for future reference. You know, a lot of the ocular diseases are silent, like glaucoma. You could have glaucoma and not even know it until you get your pressure checked and your retina examined. So it's definitely a good idea to get a baseline.
All right, let's go ahead and look at that video again. We have some more video up here, and then we can describe what we're seeing on the screen. And what is this machine?
Oh, yeah, this is where she's getting an ocular coherence tomography test. This is OCT, otherwise called. And this is excellent because it measures the retinal for different layers of the retina for disease of the retina and for glaucoma. So it really highlights those layers that are important for early detection of disease. Here she is measuring your macula, and there's a printout of the macular layers, and they all came out healthy in your case. Now we're going to glaucoma. But this is an excellent test, and as you said, it was non-painful, and it's amazing what we can get from this one piece of equipment right here. Those are all your retinal layers, and 10 years ago we didn't have this equipment.
Yeah, and what's interesting too is that to get this view, which is almost a cellular view of the retina, you would actually have to take somebody's eye out and make a microscopic slide and look at it through the slide to ever see this kind of detail. And now, I mean, obviously the patient wouldn't see well if we did that.
Yeah.
So now we get that kind of a level of detail with a painless, fast, non-invasive test.
Now what are we seeing with this picture here?
We're looking at your we were going to look at your optic nerve, and early optic nerve thinning would be an early detection for glaucoma, and that's light years ahead of this machine here, which is a visual field, which we still do run, but this would show damage after it's already done. The other machine is going to find damage before it's even showing up visually. Before you lose your vision, it's going to start showing up.
All right, let's continue talking amongst ourselves here, because we'll get back to the video later. We'll bring that up in the third part of our show. But we were talking a little bit about macular degeneration. Are there any vitamins or any kind of diet that help with that?
Well, there are some new things that have come out. Carotenoids, there's 600 carotenoids in the body. There's 3 carotenoids in the macula, and there's lutein, mesoxanthine, and xanthine. And there's a new supplement called MacuHealth, which has all 3 in it. It's the only one of the kind right now, and it's showing quite a bit of promise in helping slow down macular degeneration. That, along with omega-3 vitamins, is really showing promise.
Mm-hmm. And of course, you have the diagnostic equipment for the cataracts as well. And Dr. McCabe, you're a cataract surgeon.
Yes.
So and so what's really wonderful is if you go in for your exam, and what frequently I'm sure you've seen with your patients is they'll come in, they'll think, oh my gosh, my vision has changed. I just need an update for my glasses. And for a while, that really might be what they need, even as the cataract is forming. But everybody develops a cataract eventually, that natural aging process of the lens. And when Dr. Bovio sees that really this is the problem, and that glasses and changing them won't help anymore, the good thing is we can actually cure cataracts by taking them out and putting an implant in their place. And
Yes.
so that's really, I mean, the detection of when the cataract is actually the problem is key to
Yes.
getting help so that they can see better. So it's kind of a team approach, really.
It
It's
exactly
important.
is. It really is. And everyone's going to get cataracts eventually. It's just part of life. So, and as you can see, it's something we can easily fix. Almost.
Does wearing glasses, those sunglasses, prevent, and hats help to slow down the growth of a cataract?
Certainly, and I can't recommend that enough. Not only for cataracts, but helps prevent macular degeneration. I'll have patients who come in, maybe farmers at age 40, they already have pretty significant cataracts sometimes. Whereas the average age is 60 to 65, we start seeing a beginning of cataracts.
All right, so really a lot of patients will ask me after cataract surgery, we give them those lovely,
Yeah.
very dense cataract glasses that are
Yeah.
really not all that attractive. And they'll say, well, when do I need to use how long do I need to use the sunglasses? And I tell them it's just like cigarette smoking. When a patient says, when can I smoke again? The answer to that is never. When should I use my sunglasses? Always, when you're outside. It's important for your eye health.
Definitely.
And so getting a good quality pair of sunglasses is key to eye health as well.
And of course, Dr. Bovio, you have a lot of information up on your website, and you can go ahead and get that out.
Yeah, GulfCoastEyeCenter.com. We have a lot of information about all these things we're talking about here. All the questions about, you can almost find out anything about ocular health, disease, treatment options. It's all right there. So please, yes, go to the website and call our office if you have any questions as well.
All right, we're going to go ahead and take a little break, and when we come back, we will be answering. Oh, I'm so sorry. We have a call. We have Rick on the line. Rick, welcome to Local Doctors on Call.
Thank you.
Hi, you have a question for one of the doctors.
Yes, I was curious if there's any new developments with keratoconus, thinning of the cornea.
Yes, there is not so much to cure that, but there is new contact lenses, especially one made by Synergize. I'm having great success with that. I have a 70-year-old patient, matter of fact, she's almost blind in one eye, which has keratoconus in the other eye, and I've recently fit her with that lens, and she sees better than she's ever seen. She said she's so thrilled. The problem with keratoconus is you have so much astigmatism, you can't really fix that with a pair of glasses because you get so much distortion, whereas these Synergize lenses will stabilize on the eye, and I'm just amazed at how well she's seeing at this point. And go to my website, keratoconus, look up the Synergize lens. It's an excellent lens.
There can become a time, though, when contact lenses no longer benefit the patient, and there actually are some new treatments for keratoconus that involve putting a drug on the eye and using a laser therapy or an activating wavelength of light in order to stabilize the shape of the cornea. And so there are some surgical options as well. Of course, the best first option is the least invasive, and something like Synergize is really a powerful tool as well.
All right, when we come back from our break, we will be joined again by Dr. McCabe and Dr. Bovio answering more of your questions about eye health. So feel free to go ahead and call us right now at 361-4675, and we'll take your calls when we come back, so stay with us. Welcome back to Local Doctors on Call. Today we are being joined by Dr. Kathleen McCabe from Cantor Eye Associates and also Dr. Steve Bovio from Gulf Coast Eye Center. And we already have a caller on the line. We have Lenny. Lenny, welcome to Local Doctors on Call. What is your question?
Thanks, Alex. Yeah, Dr. Bovio, both my parents started to lose their eyesight around 40, and they both started wearing glasses. My dad needed a stronger prescription than my mom, and he wore them all the time. I'm 43 right now, and my eyes are starting to go, especially in the morning when I wake up. I just cannot focus on what I'm trying to read. I pull it close, I have it far away, and it's out of focus. But it's not all day long. It's usually just when I wake up in the morning and at night. Is there a test that I should have done, and what should I do with that?
Well, definitely you should have a comprehensive eye exam, and we need to find out what's going on with that. I did understand the first part, you're roughly around 40 and you're having a harder time reading up close now? Yeah, that's called presbyopia, and that happens to all of us, unfortunately. And it's very frustrating. You start having to hold your reading material further away to read, and et cetera, et cetera. But that's pretty common that we expect, so wouldn't get too worried about that. But just get in and get a comprehensive exam, and let's find out what's going on. What did your parents lose their vision to?
I just, I was about 16 when it happened to them. I just remember both of them getting glasses right around when they were 40.
Okay. Yeah, that's something we can correct your vision for. You're not going to lose your sight permanently from that. And yeah, you just need to get in and get a comprehensive exam and get all the answers for you.
Perfect.
All right, Lenny, thank you for your call. And we also have Mike on the phone. Mike, go ahead.
Hi, earlier you were talking about sunglasses. I work outside, and I was wondering if you had any recommendations for a good quality sunglass that would protect your eyes.
Yes, I recommend polarization. The ultraviolet coating on the lens is really what protects your eyes, but I like the polarized lenses. You take away a lot of the glare, see in the water a lot better. Everything's more vivid. You probably want to get a good name brand with that. We carry Maui Jim. We like that product, but there's quite a few other good brands as well.
Yeah, I love my Maui Jim, so they're great for fishing.
Yeah, I can't go outside without my polarized sunglasses. I love them. Once you have a pair.
Really makes a difference as far as glare goes, for sure.
So, Dr. McCabe, you performed the high-tech, the lens implant surgeries, which is the same as cataract surgery, but when you don't have the cataract removed and you actually improve people's vision, correct?
That's true. It's always an option if you are past the age of 45. That you can actually have your natural lens removed, and we can put an implant in that has all different lengths, focal lengths within it, as we were saying before, and allow people to be really with a lifetime of vision or glasses-free vision. So it's pretty exciting. And
you may also contact Dr. McCabe through Cantor Eye Associates, and you may call that number, which is 923-2020, 923-2020, and your website is cantoreyeassociates.com.
It is. Thank you.
All right. And we have Veronica on the phone. Veronica, welcome to Local Doctors on Call. What is your question?
Hi, thank you. I have been told that not everyone is a candidate for LASIK surgery. So what type of testing do they do to make that determination?
That's true. Not everybody is a candidate for LASIK surgery. And in fact, deciding whether or not you're a good candidate is one of the most important parts of your evaluation. And typically the things that we look at are the thickness of your cornea, the shape of your cornea, and the amount of prescription that you have, or the amount of corneal thinning we need to do to reshape it. So it's very important to have a very comprehensive evaluation before you have LASIK.
All right, thank you for your call. And Marcy's on the line. You have a call. You have a question, I'm sorry. You have a question for the doctors. Hi, Marcy. Can you hear us? Hi.
Either doctor is fine. My question is, my father's retina is detached at a very young age. Well, young to me, but I wanted to know, is that hereditary?
Yeah, actually many times retinal detachment causes can be hereditary things. It could be that you have high nearsightedness in your family. It could be that you have another retinal kind of thinning or splitting disease in the periphery of the retina. So if you have a family history of retinal detachments, even more important for you to come in and have that regular exam done with a dilated pupil where we look all around the back of the eye and make sure it looks healthy. Very important.
Yes, and be aware of the signs and symptoms of that retinal tear detachment. Be a lot of floaters all of a sudden, flashes of light out of nowhere that are not seeming to go away, or sudden vision loss. Any of those signs or symptoms, get in right away.
All right. We want to thank Marcy for her phone call, and now we have Anna on the line. Anna, go ahead with your question.
Yes.
Hi, you're on the air.
Okay, thank you.
Yeah.
This is a question for both doctors. I had eye LASIK surgery done in 2000, and I did fine until this year, and now I find I need bifocals. Is there a reason why that happened?
Well, I'm going to suspect that in 2000 you were less than 45, and that maybe time has passed and we've crept up a little bit more into the age where you need to have reading glasses.
No, not just reading glasses, full bifocals.
So you need the distance portion as well?
Yes.
Okay, and sometimes there can be a drift in your prescription, either because you're starting to develop a cataract or because naturally there has been a change in the shape of your cornea. You've developed more astigmatism or something like that. But the good news is that if you have enough thickness to the cornea, oftentimes we can lift the flap that you had done then and actually retreat with whatever small prescription you have now. Now again, if you're over the age of 45, that would just be for your distance vision, and you'd still be wearing reading glasses. But there's a good chance we could help you with that.
All right, thank you for your call. It was just, the show just went so fast. We absolutely, we're pretty much out of time, so we want to thank both of you for being on the show, and we will see you again on Local Doctors on Call. We'd like to thank Dr. Kathleen McCabe of Cantor Eye Associates and Dr. Steve Bovio of Gulf Coast Eye Center. And you may reach both of them on their websites. There's CantorEyeAssociates.com and also GulfCoastEyeCenter.com. So we'll see you next time on Local Doctors on Call. And remember, it's your health.